State of Texas Health Department says the Lone Star State is officially facing a new wave. We've talked a lot about the Delta variant. It is spreading at a staggering pace among the unvaccinated. There is some good news. The 7-day average for people getting the first dose of the vaccine, that's up 93%, almost doubling. As we've heard so many times, health experts say getting that vaccine, that is your best line of defense and collectively our best chance to end the pandemic. Of course, with the Delta variant, some of you are wondering just about how well you will be protected in the future. And there's been a lot of talk about booster shots. Will you need a third shot if you had the Moderna or Pfizer, a second shot in the case of Johnson & Johnson? Sonia Zad joins us to break down just what we know about that potential third shot. And the news is changing every day, it seems. Sonia?
So around this topic, yes and no. It's being studied right now, so we got to wait. That's the bottom line. But Mark, this is one of the top questions I'm getting right now. Can I get a booster shot? When will we need one? How will you know when you need one? So let's start with what we do know. Boosters are outside of the current CDC guidance. There is no FDA approval around this right now. And your vaccines are doing what they're supposed to be doing right now. That is keeping you out of the hospital and preventing death. So why is this buzz around booster shots intensifying? Well, you may remember Pfizer sought approval for a third shot of its vaccine regimen, and that's been green-lighted at this point in the UK, Israel, and Germany. But federal officials in the U.S. say booster shots are not needed yet. Wednesday, the World Health Organization Director General called for a moratorium on administering COVID-19 booster shots until the end of September because he says, look, it's not fair to give boosters to people in rich countries while people in developing countries have little to no access. Some nations at this point left suffering and struggling to protect their most vulnerable citizens.
Because we have to approach this, as the Director General said from the very beginning, we're in a pandemic. The entire world is in the middle of this, and as we've seen from the emergence of variant after variant, we cannot get out of it unless the whole world gets out of it together. And with the huge disparity in vaccination coverage, we're simply not going to be able to achieve that.
Okay, so do you need an extra dose of the COVID-19 vaccine? If you're immune compromised, maybe. If you're older than 65, maybe, but not yet. If you're younger than 65, probably not for the foreseeable future. Stay as healthy as you can for right now, and of course we'll let you know when peer-reviewed data is published and see what the studies show. And even though we're talking a lot about this COVID vaccine, by the way, there are still other shots that you adults and children especially cannot put off. That reminder coming up for you at 6:45. Mark?
Some of that get lost in the shuffle. Thank you for that, Sonia. So let's say you do want to get your first dose of a COVID vaccine. We've got you covered. Text the word vaccine to the number you see on your screen there, 214-977-6028. We will send all the information back straight to your phone. 6:36 this Thursday.